Hello, everyone. A very good morning to all of you. I'm Dr. Ankit Goel. I'm your mentor for the FRCS Urology course. And today I'm going to talk to you about this Section 2 online course that we conduct and what all can you expect to learn from the online program. So, Section 2 is a Viva exam where you are expected to communicate like a consultant and express your knowledge in a very systematic manner. And you're also expected to have a high level of thinking so that you can come out of the different complicated case scenarios in a very safe way. You're also expected to be updated to the latest guidelines, to the latest evidence, and bring about the evidence in the right case scenarios in the appropriate time. So, what our goal is, our first goal is to help you in the communication. So, we are all practicing consultants. We know our subject, we are masters of our subject. Okay, you might be practicing for 10 years and you do a lot of surgeries, but when it comes to express your knowledge, express your approach in a few sentences, appropriate for the exam in a time constrained manner, you find it difficult. That is what the most common problem with the most of the candidates appearing for the exam they face. It's the time limit. You can talk on prostate cancer for an hour, but when it comes to speak on a topic, particular topic, in a very relevant few sentences, then the whole challenge is. And that is what we are going to train you for. We are going to train you to understand the communication and in a time constrained manner, how you can make a relevant communication or a conversation like a consultant to a consultant in a very few sentences. So you can do it by understanding two things. Number one, how to initiate a conversation. Number two, how to maintain a conversation. So the whole idea of any communication is you should be able to initiate it properly. You should be able to maintain it. You can initiate a communication if you know the opening gambit. What is opening gambit? I've told it previously also. It means the first few sentences that you say, the first few minutes that you talk to the examiner gives an impression that, okay, this candidate knows the subject. The examiners are very experienced. They know that the candidate knows it or not from the first few sentences itself. The second thing is you should be able to know the keywords. If you know the keywords, you can maintain the conversation. Maintaining is another an art. You should be able to frame fluent sentences and communicate in a very matured way so that the examiner knows that, okay, he knows the subject again. So initiation and maintenance. Initiation, you should know the opening gambit, and maintenance, you should know the keywords. Okay, so this is what we are going to train you for. Understand how do you communicate and maintain and initiate a conversation. Number two, you should be able to bring about the appropriate evidence at the appropriate time. Don't think if you know the AU guidelines, if you know the BOWS, you can bring about any evidence anytime and that's going to help in scoring marks. No, it should be at the relevant discussion, at the relevant point where you bring about this meta-analysis, where you bring about this guidelines, and that gives a good impression to the examiner. Then that's a positive thing. That is what we are going to train you for. Otherwise, you know everything. I know you have passed your section one, your knowledge is very much updated. But now this is the section two exam where you need to communicate everything in a very systematic way. Having understood the goals, let us come. How do we do it? Number one is we conduct 16 online sessions. And most of you are practicing urologists. We do it on the weekends to help you so that you can attend the interactive sessions. We conduct 4 Viva sessions every day. Each Viva is for 10 minutes, and we have a feedback session in detail. What are the problems? What are the mistakes the candidate is making, and how we can get it better? What are the current guidelines? What could have been quoted in the discussions? We take it everything and we try to finish that case. So 10 minutes for each Viva, and we take around 20 minutes for the feedback. So that's a 2-hour session per day. We encourage everyone to participate and volunteer for the Viva. Every feedback is important. Everything that we discuss are going to be important. If you are not able to attend a session, don't worry, we provide you with the recordings. Second thing is, apart from the live sessions and the recordings, we also conduct the mock exams. So we conduct 2 mock exams. What do we mean by mock exams? We conduct the Viva in Dreams. So we have launched recently Viva in Dreams. And what is the meaning of Viva in Dreams? It means that we conduct 20 minutes Viva on a particular station. It is to be a random station with an idea that you must be prepared for the Viva every time, every moment, even in your dreams. So you will be allotted a date where you will be asked a Viva and you will be not knowing the topic of the Viva. So we conduct it after we are done with 4 stations at the middle of the course. One candidate is going to have this and it will be a private session. Nobody will be knowing what is going on in your mock Viva. And there will be again private one-to-one Viva at the end of the course after we have completed the 16 classes. So 2 Viva sessions, recordings, and the live classrooms. We try to bring about almost 100 clinical case scenarios in the whole discussion. And trust me, there won't be much strange scenarios apart from what we have discussed. You won't be finding something very twisted, so very undiscussed scenarios in your exam. You will have your base ready if you are confident with the cases that we discuss. You need to have a trust, and you need to have a persistence, and you need to stay updated and read and express yourself and practice a lot in every sessions. Okay. And we also encourage you can make your own groups during the sessions. So you will be encountering your friends who are appearing for the same viva. You can make a small group. I always encourage to make a group of 4 so that you can practice during the weekdays and you are ready for the classes in the weekend. So this is another advantage of this course where you can meet your colleagues who are going to appear for the exam, and you can have a practice group of your own as well. So that's all about the introduction of the Section 2 course. What I'm going to tell you is we try to bring everything into one platform. There are a lot of courses, and practicing urologists find it very difficult to travel and attend the courses for 7 to 8 days, leaving everything. It might be difficult for you. For that, this is a platform where I can ask you to trust. Candidates have benefited previously a lot, and I'm sure you will do it as well. Thank you all. We are planning to start our classes from December for the May session. It takes 6 months. It's an adequate time for you to have the preparation. Since the January exam got postponed and the May exam is coming for the UK candidates, and the January exam, we don't know, it might be held in the middle of the year. So we are planning to start in December, held a once weekly classes to space it for 4 months. As I said previously in my video, we are going to space it for 4 months, one session per week for 16 sessions. We are going to complete in March and held mock exams after that, so that you can have a lot of revisions and a lot of practice by the time you attend your exams. So all the candidates, Section 2 candidates, international candidates, the UK exams who are going to write Section 2 exams in May, this is an opportunity for you. I'll share with you the details soon. Till then, see you soon in the classroom. All the best.